Government Law Center Director Pat Wilds is going to facilitate the discussion. Pat joined the Government Law Center in January after nearly 5 years working in the governor's office. So thank you, Pat. I'll pass it off to you.
Great. Thank you, Shell. Good afternoon, everyone. As Shell mentioned, I've been back at my alma mater here, Albany Law School, just for a couple months. I most recently served for Governor Hochul as one of her assistant secretaries for Human Services and Mental Hygiene. So when I heard upon coming on board that we were doing a program that spoke to the impact of state and local government on the homelessness discussion, I was thrilled and excited to jump right in and moderate. I'll get going here and start to introduce our panelists. Their full bios and information are all available online, so I'm not going to go through their bios, but they all have very accomplished and really esteemed resumes behind them, and we're thrilled they're joining us here today. The first is Jennifer Quijano, who's the director of the Shelter Advocacy Project at the City Bar Justice Center. Next is a good friend of mine, Ken Zimmerman, who's the CEO of Fountain House and distinguished fellow at NYU Furman Center for Real Estate and Urban Policy, and probably a bunch of other hats that we don't have written down. Next is Keith Brown, closest to us locally here in the Capital Region. Keith is the Public Health Director for Schenectady County. We really wanted to make sure that we featured some folks from upstate as part of our statewide programming. And finally, but certainly not least, is a friend of the law school as well, Luke Sikinyi, who's the Vice President of Public Policy at the Alliance for Rights and Recovery. And Luke's actually going to be on any moment because he's just getting out of a press conference on one of the issues we're actually going to discuss today. So usually we don't make exceptions for panelists being late, but especially because it's on point, it seems entirely okay. So I'm actually going to help kick off the discussion here. Full disclosure, there's certainly way too much to discuss when it comes to the topic of homelessness and people who are unhoused to capture it within an hour, but we're going to do our best. We'll start off with a lightning round for our panelists. And, I'd like to say that the lightning round is going to be asking everyone when the state budget's going to be done. I don't know that any of you have that answer. We certainly don't here, so feel free to chime in on that. But in all seriousness, based on all of your relevant experience, where you sit in your current role, or based on what you've done in your career to date, my first question to all of you, and we'll start with you, Jennifer, is what is one or perhaps the single biggest factor that contributes to a New Yorker finding themselves unhoused or experiencing homelessness?
Thank you, Pat. And your guess is as good as mine on the state budget, but we'll be happy to hear updates as soon as we get them. For my part, I would say the biggest factor that I've seen is the consistent lack of affordable housing. That continues to be a factor that I see. I spent many years as a housing practitioner working on eviction prevention. And that's what I continue to see now is that when there isn't enough supply of affordable housing, that results in more cases being brought to court against folks who may be experiencing the need for affordable housing, but find themselves in an eviction case. Even though the Right to Counsel has done wonderful things within New York City to help slow this rate and is a really valuable program, it's not the only program that's needed. And this is something that we see as a reason why people enter shelter, and actually why people continue to stay in shelter is because there's not affordable housing to go to. Even with housing vouchers and other important programs, that is the key thing that I come back to is the greater need for affordable housing.
Great, thank you. I couldn't agree more. Ken, how about you?
I mean, one starts with housing, like the old real estate joke, because I think that was very well covered by Jennifer. I want to talk about unsupported serious mental illness. And I think the reason is that, from work I'm doing about the closure of Rikers to the dynamics in New York City right now, so much conversation's taking place about people with serious mental illness that it's important to note it and qualify it by talking about the lack of support that could be made available to diminish it, but right now is not. And I think it's worth reinforcing, just to give some numbers, that in New York City, there are roughly 250,000 people with serious mental illness. The estimates in terms of the unsheltered population of those with serious mental illness is about 2,000. So I want to make sure we don't conflate serious mental illness with homelessness, but because of the nature of the debate, it's critically important to indicate for those who are homeless and have serious mental illness, we know of interventions that can and should be applied. And that kind of concentrated attention on what can be done, I think, is a very important and frankly underdeveloped part of the conversation.
Thank you. Keith, how about you?
Yeah, sure. I mean, in addition to what Jennifer and Ken already said, I think I would just add, just general income inequality, right? So you have this lack of affordable housing, and then income inequality where, the lack of ability for people to work a living wage and still afford housing. Even in many cases, all of us will tell you, that a lot of folks that we work with or have encountered are people who even sometimes work full time and still can't afford housing in a lot of places. And so, I think this combination of lack of affordable housing and then income inequality means that, if we were in a better scenario where, there was both affordable housing and people who could work, even low income minimum wage jobs and afford housing, it would sort of push everything up, right? So then the housing that was available, support emergency housing, would be really sort of the lowest level of the safety net for folks, and then everybody else would sort of move up the spectrum. And so again, this is complex. It's hard to say something that hasn't been said. It's housing, right? And I think that's going to come up a lot of different ways. But also just the simple fact that you can't work a job and afford a 1-bedroom apartment in a lot of places, and so that's a real problem.
Thank you, and duly noted that going third when the obvious and probably best answer is lack of affordable housing is a tough go. So thank you for that. I agree with everything that everyone said so far. Luke, welcome. I hope your press conference went well. The first question we're doing in this lightning round is, in your experience, what is perhaps one of or the single biggest factor contributing to homelessness here in New York today? So far, the answers have been housing. Ken mentioned unsupported serious mental illness, and of course, Keith mentioned income inequality. So curious if you have anything else to add before we keep going.
Yeah, Luke Sikinyi, I'm with the Alliance for Rights and Recovery, the Vice President of Public Policy there, and I would agree housing is probably the number one thing. And also, with our other panelists, we'll say that income, poverty, and just that mix of access to social supports. I think when you're talking about serious mental illnesses, that is often really thinking about how we get treatment services, how we get social support generally, build community, and also go back to work, get education. But I think generally speaking, a lot of times we have this mix of poverty and lack of accessible social support for your social needs, whether that's not being able to access education in a way that is helpful for you, or discrimination often also compounds with this. So I think all of these things really do mix in quite a lot to lead to homelessness. And then once you are in that position, the difficulty of navigating the social service system also just compounds that even further. And oftentimes you can develop a mental illness just because of the intense stress and fear and danger that you often are in when you are experiencing homelessness. And while there's a lot of support out there to help people, I think it's often really inaccessible. It's hard to figure out where that support is, and even more difficult if you don't have a stable place to keep your things and understand how best to make appointments and things like that.
Well, great. Thank you, Luke. And we're happy to have you here contributing to the conversation. Something that Ken and I were actually chatting a little bit about, the whole group really was before we got started today, is this topic of involuntary commitment. And we'll start with that. Very mindful, Ken, of also as to what you noted a couple moments ago, that when it comes to the discussion of homelessness, there is, in this point in time, when it comes to public discourse, in my opinion, quite some conflation when it comes to the two topics. Now, is there overlap? I think the data will show that there can be, and there is overlap. But is every person that's unhoused experiencing mental health issues? No, we can pretty categorically say that. And how many of those folks are experiencing, serious mental illness that would amount to them being in a position that they meet legal standards, actually be brought in for assessment and potentially actually being admitted? Probably far less. So keeping in mind that framing, we did think it was really important to have a discussion about involuntary commitment today, because as we look at the budget. And Luke, we didn't get your 2 cents on this, but I don't think anyone had a really great idea for when the budget was going to wrap. So please chime in at any point if you do have that answer. I'm sure there'd be a lot of reporters that would love to hear that answer as well. But let's jump in a little bit to where things stand with the involuntary commitment proposals in the budget. Also, being very mindful here that a lot of us hopefully are very familiar with some of these concepts. Some may not be, and if you're here for COE credit, I'll try to do a very rough overview of involuntary commitment, and I'm going to kick it to some of our panelists for their input. Involuntary commitment here in New York, is governed by the state mental hygiene law, Article 9 in particular. John Torriello, who I think is on with us today, was actually one of the drafters of that. So hello, John, from afar, and thanks for chatting ahead of time for today. But what the governor's proposed this year is a bunch of technical, amendments to different parts of Article 9. What I'd like to spend a little bit of time on today is this proposal to expand the criteria that can actually be used to both transport someone who's deemed in need of assessment to a hospital for that assessment, and ultimately, in some cases, to actually be admitted. The way the law currently reads is that the standard is to I want to make sure I have the language right here. The law includes currently a substantial risk of physical harm to the person as manifested by threats or attempts at suicide or serious bodily harm or other conduct demonstrating that the person is dangerous to themselves, or a substantial risk of physical harm to other persons as manifested by homicidal or other violent behavior by which others are placed in reasonable fear of serious physical harm. The governor's proposal this year would add to that standard with people also being able to be involuntarily transported and perhaps ultimately admitted for posing a substantial risk of physical harm to the person themselves due to an inability or refusal as a result of their mental illness to provide for their own essential needs, such as food, clothing, medical care, safety, or shelter. So, Luke, I'm going to start with you. Where do you think this debate actually stands in the budget right now? And what is your stance from the Alliance and Rights and Recovery perspective? And one other thing I'm going to add before I mention this is I know that both your organization and Ken's organization in May signed on to a letter that went to the legislature with maybe some concerns over this and some proposals for what else the state could be considering. So with that, Luke, curious for your thoughts.
Yeah, I mean, I think the biggest piece here is, at the Alliance for Rights and Recovery, we have been firmly against the expansion of involuntary commitment, mainly because we want to support the same sorts of folks, people who are on the street and dealing with mental illnesses and really need some support. But we also know that there are ways to do so without involuntarily removing and committing them. I think from a very technical perspective, this push to include inability to meet food, shelter, and clothing needs. We really don't see hospitals as the best place to get food, shelter, and clothing. You might be, out of the street for a couple of days to maybe 2 weeks, 3 weeks. But the truth is you're still going back to the same situation that you left. And that's really the crux of our problem. I think a lot of this has been centered around this conflation of folks with mental illnesses being violent and, being seen as this approach is really being pushed as a public safety approach. But what we know is that, the general population for folks with mental illnesses are not violent, and that there are many more ways that are more effective to support people, like intensive and sustained engagement teams, which the governor and the legislature approved multiple of these programs in the last couple of years. And we've seen a great number of successes through this, with a high percentage of the people who are referred, over 80%, accepting services, which really begins to dispel this myth that people do not want to receive services. People are asking for them. They just don't have access to them. A report came out this week that showed that there are thousands of people on wait lists for supportive housing and ACT teams, things that have been very successful in reducing homelessness, in particular for folks with mental illnesses, through the Housing First model, which couples the two. So we have really been pushing for these alternatives because that's what we know really are effective, the community-based services that are effective to keep people out of crisis, keep people off the street, and get them back into recovery. And as far as the actual negotiations go, the Senate and the Assembly both rejected these proposals in their budget proposals, their counter proposals, but the governor seems to be very dug in on this. So we've been, doing a lot of work as advocates, as providers, to really explain what needs to be there. The press conference I was at earlier was talking about housing and other additional services. But one thing I do really want to mention is instant review panels. A lot of this has come from these critical incidents of violence involving people with mental illnesses, whether they were the perpetrators or the victims of that. And what our state has failed to do has been to investigate what actually happened in these critical instances, figure out gaps in the system, and then provide recommendations. I'll pause there to let Ken kind of speak a little bit as well.
Thanks, Luke, and I think you presented it very well. So let me just add a couple of points, really speaking as much as a recovering lawyer as anything else for current purposes. The starting place is, how much is this needed, even for those situations that people identify? And Pat, you can probably go into more detail, but the reality is, for those circumstances, there's guidance from OMH that suggests there's flexibility beyond some of the aspects. And so the question is, why would one need to take up the kind of statutory change that, frankly, is being proposed? From a Fountain House perspective, and I'll talk more about us, we're a voluntary community of people with serious mental illness that work with staff to advance recovery and thriving. And what's striking as one talks in our community is how much the view is that involuntary commitment needs to be a last resort rather than a first resort or a default. And so anytime one is talking about expanding something that is depriving people of civil liberties, not that it's never ever appropriate, but that one needs to be really clear about why one is doing it and the circumstances in which it is warranted. And especially as you articulated the standard that the lawyers among us know, that is as broad and wide-ranging without guidance that would in any way circumscribe it. And the legislature's clarity under the existing standard about what is and meets that standard and what does not is, I think, a very important part of how one should cabin such things. Now, of course, at the same time, the question is, what is needed to meet those individuals who face very difficult situations? And I think, as Luke explained, fundamentally, the idea that we know from, the type of instant review panels that Luke mentioned to ACT teams and a whole host of a continuum of services for those who may be in crisis are absolutely critical and need to be the source of investment and attention. And unfortunately, the division of the debate between involuntary commitment and those broader needs that we know can address the issue, I think, is a source of major concern. And then just the last piece that I'd observe for now is the question of how are we really and meaningfully ensuring that in those circumstances where involuntary transport or commitment might happen, we're actually addressing the underlying needs that somebody has. And to me, as somebody who's had positions in policy at state, federal, et cetera, the absence of meaningful attention to the data that should be collected, the evaluation that needs to be done, so that the idea that you're taking somebody for 72 hours and then putting them back on the street and expecting a different outcome from what you were concerned about obviously makes no sense. And so I think the beginning of some of the data that the city of New York has put out is striking, and it suggests that under the existing standard, many people, in fact, are hospitalized, but many are not. And the absence of a serious interrogation of what it is that is actually effective, especially when the deprivation of rights is at stake, seems to me to be a critical part of what it is and why, from our perspective, we're really deeply committed to this being a last resort as opposed to a default.
Yeah, and I just want to one last thing I wanted to mention, and I think my lawyer friends would be upset if I didn't mention this. I think the push to expand this definition, it's seen as in line with court decisions over the last few decades, but the truth is they're expanding what was decided on as far as considering someone's ability to care for their food, shelter, and clothing needs. That decision is really made by clinicians, and this expansion of the criteria would then also have police officers make those same decisions on the street, where they're not clinically trained, they don't have the years of training to identify whether this is a mental health issue, whether this is really someone just willfully deciding not to use these systems because they've been harmed by them, and that's a legitimate decision, or whether it's something else. And I think that the danger that we see is in pushing police and forcing them, who often don't even want to do this kind of work in the first place, to make these clinical decisions when they don't have the training to do so. I think it's a real failure of the mental health system. It's a real failure of policy for us to be doing that instead of focusing on what Ken was just mentioning, and that those critical services, those other supports that are needed to help people long term.
Thank you both. I think this is really informative. And as I think through this from my perspective, before I pass the baton to Keith, I'm curious for his thoughts as we kind of move towards maybe more of a robust discussion on the community-based services side of things. Is, a lot of these proposals come, frankly, because there's a public perception issue when it comes to some of these issues. People are walking down the streets of different parts of New York City, probably in particular, but I know that there's a focus on this increasingly upstate as well. They see someone who doesn't seem to be doing well, might be acting less than traditional, for lack of a better term, and what can be done to help that person. I think everyone kind of comes at this issue ideally from the perspective of that person might need some type of support. I think everyone's well-intentioned in thinking that. I think the actual type of support, though, that is given and that actually works is a very different discussion. Another thing I wanted to point out that, Luke, you alluded to, but just to put a finer point on it, the standard that the governor's proposed expanding to both is already in guidance that the Office of Mental Health has issued and is also already in case law. So this would kind of be adding a belt, suspenders, and perhaps a third mechanism to uphold the same standard. But a lot of folks would say this is how things are already being practiced as it is. I guess the final thought is, a lot of these concerns come out of, things you're seeing on the headlines in New York City, right? You see someone get stabbed by someone who's wielding a knife, and there's no doubt that that's scary. There's no doubt that that's concerning. Sometimes that person may have a mental illness, sometimes they might not. But when we look at the standard, is that person who's engaging in that conduct actually now going to be able to get involuntarily removed, or were they already able to under the existing law? And is it really solved for those issues to begin with? I think it's just an important framing perspective. I'm not sure that it's an apples to apples comparison. So I wanted to put out that out there as my 2 cents here. But Keith, let's move to you as we look at community-based approaches. Obviously, Ken and Luke have promoted this considerably, and I think there's good reason why. What does the situation look like on the ground right now in Schenectady County and perhaps in the city of Schenectady itself? And what are you guys doing to address homelessness from, maybe a harm reduction perspective, or on the voluntary support side?
Yeah, thanks. I do just briefly want to mention in terms of framing around these involuntary kind of proposals. Whenever we get there, and whether it be on drug policy or mental health or housing, whenever we get there for coercive, carceral kind of approaches, it's like a real sign that we failed in terms of actual investment. I just think, and I know everybody sort of mentioned that, but it should be a real warning sign for us that we do this thing where we gut social safety nets and divest in all of the things that we know work and all the data. And those of us who've done policy work, you go and you try to educate people and say, this is what the data shows works. You have directly impacted people come and say, this is what worked for me. We need more of this. We need more of that. And so what happens is none of that happens. And in many cases, right, there's a divestment. And so then it's sort of like you gut the things that we know work, and then everybody screams out we need an answer to this. And then we end up with this pendulum swing where it's carceral approaches that we know from the data are less effective than the voluntary services we're all promoting, right? And they cost an awful lot more in many cases to involve law enforcement and involuntarily doing these things. And you do things like sweeps and cleaning. It's I just want us to all sort of make sure we continue to level set to say yeah, we're in the midst of the details of these discussions, but this is what happens when you don't make the investments work. So I just wanted to sort of put that out there. Now talk about something we're doing locally around this stuff that's trying to take a different tack. So we have a program, a collaborative program between lots of actors in the municipality, including law enforcement, clinicians, our local, medical providers, county folks, nonprofits, everybody else that we call our hub. And to your point, Pat, it's a person-based harm reduction approach that is about proactive outreach to the folks that are around in our community, to try to kind of circle up all of the different actors in a way where everybody's moving in the same direction on what that person's kind of self-identified goals are. We are a county of only 157,000 people, right? So we're much, people in New York City are like, that's nothing, right? But what we're doing is showing that there's a model that can work, and there's sort of high utilizers, familiar faces, whatever you want to call them, coordinated models that exist in all sorts of places. But what we've sort of learned is getting everybody on the same page about that person-centered harm reduction approach has been a challenge, right? When you have a business owner who calls and says, this person is causing problems for my business, or they're harassing customers, or acting erratically, or whatever that is, they want, what they often are asking for is someone to respond. And so in terms of municipal strategy, you have to decide and develop the who else responds rather than law enforcement, and what do they do? Because oftentimes, again, the expectation that people have is that someone does something, and that the immediate issue gets sort of addressed. And so when we're talking about carceral approaches, right, the immediate thing that happens is that, somebody shows up, they do an evaluation on that person goes away, right? That's what the business owner or the citizen complaint sees, right? That person's gone. When you have an approach like what we're doing is, somebody goes and says like, hey, can we go grab a cup of coffee? Can we chat? Can we sort of like, could you walk with me a little bit? Could you do that? It's sort of a different way of getting to the same immediate answer, but the long-term solution is we believe a better one, because you're not putting that person in, to inpatient mental health, and they're out, to the same circumstances, where then there's going to be another call. And so we're going to end up in a rinse repeat kind of strategy. So what we've done is, again, it's proactive. People are out there doing outreach to the local kind of encampments that we have, and to places where people congregate, and doing sort of an approach that way. And then when law enforcement is called, it's typically law enforcement and then someone from that model that shows up. And our law enforcement folks here, thankfully, are very much on board. Anytime they've had to do a major kind of operation with like an encampment, it's been sort of a long-term approach. They bring in providers to work with those folks to try to get alternatives in place. There's no like, we took all your stuff and threw it out, and now, go figure something else out. So we've tried to make sort of the municipal approach be a much different one. And I will just say we're at a point now where we're seeing buy-in from the business owners, even some who were very skeptical early on about this, and they really wanted for that person to be arrested or to go away and go to jail. And so now they're seeing long-term, like, oh, I've seen this person less or not at all at my business. And so now they're sort of telling each other like, yeah, this thing works, and give it a chance. So sorry, I know that's a long answer, but this stuff is complicated.
No, that makes a ton of sense. It's a good segue for us to Chell. Do you want to announce our CLE code now for all those who are pursuing it?
Yes. For those of you who are attorneys admitted in New York State looking for CLE credit, your CLE code is RENT, RENT as in the musical, spelled R-E-N-T. That goes on your CLE affidavit of attendance. Again, your CLE code is RENT. Thank you.
Great. Thank you, Chell. And thank you, Keith, for that most recent answer. One more question, I think, on the community-based side. And then, Jennifer, I want to jump to you right after this to talk about some of the work that you're doing at the Shelter Advocacy Project. Ken, can you speak a little bit more? You mentioned the clubhouse model. I know this is a model that's of course, quite a lot of interest to Fountain House, considering that that's your bread and butter. But Luke has expressed a lot of interest in this as well. I'm assuming a lot of folks tuning in today might not be familiar with that. So what kind of community-based approach is that? How do you work with folks who might be experiencing homelessness, and what type of outcome metrics perhaps are you finding in terms of the efficacy of your programming?
Yeah, thank you, Pat. And Keith, let me just say I want to thank you for the framing that you offered, because I just want to say, and I will talk about the clubhouse because I think it's significant as one of a number of things that can be a powerful response. But Keith's observation, it's really that there's an enormous amount of innovation taking place in this space. I think I want to give the governor credit for investments, including in her budget for some things that I think are critically important. And in many respects, expressed some frustration that the level of attention on what can work, and especially work not just in terms of saving money, but in terms of the long-term solutions that improve lives, that strengthen our communities, really can and need to be the focus of attention. And it's in that vein, the Clubhouse model, which was founded 77 years ago by 6 former psychiatric patients who started meeting on the steps of the New York Public Library and saying we needed each other, has now grown into a movement of over 200 clubhouses around the country. And what they are, as I started to say, is a voluntary community of staff, and we call people with serious mental illness members. And it's only the people with the most serious of mental illnesses who collectively come together and develop, under the guise of what we call a work order day, a mechanism by which community is established. And with that trust having been done, facilitates everything from housing to employment to education and all the rest. Right now in New York State, there is only one clubhouse upstate. It was just recently established in Poughkeepsie, and we're pleased that the governor has included in her budget an additional $8.5 million. Assemblywoman Tapia has proposed a $15 million, with the idea that this kind of solution can be brought throughout the state. And I think it's a remarkable opportunity. In terms of metrics, at Fountain House, where we operate 3 clubhouses in New York City as part of a network of over 14 at this point, with 2,100 members, as we put it, we have strong evidence that there's a 21% reduction in Medicaid costs. 36% of our members were previously unsheltered, and 25% had some forms of justice involvement. We have twice the rate of employment of comparative models. And perhaps most significantly, what we're establishing is the stickiness that Keith referenced being so critical. So that if somebody is given a short-term intervention, what happens afterward? And in essence, what we do and strengthen so many other programs by allowing somebody to have a home, a place where they belong, and with that, make these other types of time-limited interventions able to do what they should do, as opposed to being called on to do things that go far beyond them. Last point, and then I'll turn it back to you. We're very excited in Los Angeles to give a model of something that's outside of our home state, where we've been asked to be a core of a $116 million homelessness prevention effort in Hollywood. And where this high-quality clubhouse is one of 6 pillars that includes clinical care, includes housing, but it is a re-envisioning of what it is that we should be doing, that places recovery and thriving at the center of what our interventions should look like. And knowing that if we do that, what ends up happening is a huge reduction in the level of long-term unsheltered homelessness, and actually provides the kind of benefits to individuals at the same time that we want to see.
Thank you, Ken. And I can certainly attest to having visited your clubhouse on a couple of occasions, that the impact that it has on the people, everyone that steps foot in the door there, both folks who are working there and folks who are being supported there otherwise, is really fantastic. So thank you for sharing that summary. Jennifer, I want to move to you next. You know, as I mentioned earlier, you're very involved with the Shelter Advocacy Project at the City Bar Justice Center, and you're focusing on a lot of unmet needs of New Yorkers experiencing homelessness. So I was wondering if you could get into some of the work you're doing, perhaps pertaining to, you know, cash assistance rates and maybe storage issues that you and I have discussed previously before you joined the webinar today. So I'm curious kind of the work you're doing and how you're seeing it impact folks experiencing homelessness.
Yeah, absolutely. So something that we had come up through some client focus groups were really, there was an outstanding need to expand legal services that were being offered by our office, and I would say by legal services providers at large. we re-envisioned our project to become the Shelter Advocacy Project because we wanted to make sure that we were able to meet more client needs as they were coming to us. While historically the project has focused on cash assistance, and of course there is a lot of important work to be done around cash assistance, namely first that just having access to cash assistance and other cash-based benefits continues to be a concern because it doesn't just affect the amount of money that's coming into a household. It impacts, if you're not able to open a public assistance case, you won't be found eligible for a housing voucher like city FEPS, something that may be able to help a family transition from shelter into permanent housing. So without having those approvals, that can extend the amount of time that a family spends in shelter. And knowing that on the back end as well, even once you do receive that housing voucher approval, you won't necessarily immediately find housing. It still takes a long process, and there are many delays that come with that, in that we can of course spend lots of time talking about. But one thing that is really pivotal now that is currently written into the Senate One House budget is an expansion of the amount of cash assistance that would be issued to people that reside in shelters that serve food. Historically, the amounts, if you are in a shelter that serves 3 meals per day, you would receive substantially less cash assistance than the amounts that are already pretty low on their own. A household of 1 would receive, in this type of shelter, $45 a month in cash assistance in New York City, which cash assistance is not necessarily implied to be used for food purposes, so the reduction doesn't quite make sense on its own, but it's such a low amount of money that it would help essentially to keep somebody within shelter without giving them the resources and the ability to be able to move forward out of it. The proposal within the budget now is to not just level set the amount of cash assistance for people in shelters that provide meals, but to actually double the amounts, which is something that we hope to see, sooner than later apply to everyone within the city and the state at large. Being able to raise this amount of cash assistance, just the way that it's proposed, would really cause a substantial increase, especially for households that are more than just a few members. Being able to expand the amount of money in hand would really make a difference in being able to meet all the needs that someone has. So our project, while we continue to focus on cash assistance and helping people ensure that they're found eligible and enrolled in the benefits for which they may be eligible, we had many clients coming to us with concerns around other needs that weren't being met. So it could be within New York City, of course, we're very grateful to have a right to shelter, but there are many logistical issues in even being able to access shelter, lots of things that you have to prove about your housing history and everywhere that you've been in the past 2 years. So we're working with clients on issues like that. One issue that came to us and I'll just kind of walk through what we learned from one particular client. We had a client who had recently experienced an auction of her storage unit. We were particularly concerned in this situation, first because it was very clear from even her initial email that she had been contacting many different organizations, legislative offices, just trying to find anyone that would be able to help her with this issue. She reached out because within that unit, in addition to losing many, many important items for a household, like furniture, even she lost the degrees that she had been issued from the college she attended. But in addition to that, and even more heartbreaking than that, she had had the ashes of a son that she had lost many years ago in that unit. And she had done, from her perspective, everything that she was supposed to do. She had applied for a benefit that already exists from our local Department of Social Services to continue to have her storage paid for throughout the time that she was needing assistance. This benefit was approved, and then at some point this got cut off. There's supposed to be an automated storage payment system. Our experience is that things never end up automated, and unless you're delivering a bill every single month, you will not get this approved. And even if you do deliver your bills, as this client had, sometimes you may come across somebody who's having a bad day and decides they're not going to approve payment. Her payment was not approved. Her unit went to auction. And unfortunately, she lost everything that she had, which, you know, in addition to thousands of dollars of loss, there's so many personal and priceless items that she'll never be able to get back. So this became a really pressing issue to us, because as soon as we took on this case, there were many more that followed behind. As soon as we opened the door, we learned that this was something that people are having issues on the front end of it, with just getting the payments issued timely by HRA, because what we've learned from, you know, more of a legislative perspective and a procedural due process issue is that if at any point a payment is not approved and there's an auction scheduled, there's essentially no procedural due process for, you know, post the deprivation of this unit. So there's really nothing that can be done to undo the harm that's been done. And that's something that we're at this point trying to get to the core of, because we're seeing all the very, very real human harm that this is causing, and the financial impacts that it has on the household to try to recoup these losses and to try to start fresh. And especially when somebody is, you know, the goal is to always re-enter permanent housing. If they're going to be doing that, we want to make that as easy as possible rather than as challenging as possible. So, and something else that we're able to offer within our project, in addition to really accepting this model for ourselves of sort of listening to what the issues are that are coming up and expanding our practice as we go, we're very fortunate to have an in-house social work team that works hand in hand with us, because we know that there are social supports within shelters. Often our clients need more support than what they're able to get, because there may be long wait times just to meet with like your housing specialist in your shelter. Clients sometimes have weeks-long delays just to meet with someone that's within their own shelter facility. So providing both social work support to the legal work that's been done has been a really important partnership in what we're doing. All of this to say, I work on a team of 2 people. Many folks in partner organizations that I know, there are either not specific programs focused on legal services for people experiencing homelessness, or there are programs, but the size of the team may be smaller than what is really needed to meet the need that's out there. So to the extent that there can be more targeted state funding delivered to organizations to really focus in on these issues, we're learning that the issues are plenty, but what's really needed is the resources to be able to meet the need that's out there.
Well, thank you for all of that insight into all the work that you're doing. And, you know, until you and I had spoken prior to this, the specific kind of storage issue related piece just hadn't been something that had even occurred to me. So I'm both glad to hear that you've uncovered some cases there that you're able to hopefully help with, but obviously discouraged to hear that it's happening to begin with. Your last comment specifically about the fact that you're a team of 2 attorneys doing all this critically important work kind of brings me to, you know, hopefully my final question and maybe a short lightning round for this group before we go to some Q&As that have been submitted by those in attendance is, and Keith, this maybe goes to something that you and I talked about previously, is where are the gaps in the system, or what are kind of the big issues that without their being addressed are going to keep us from really making progress on supporting people who are unhoused? I will start and just say that I think the workforce piece generally, Jennifer, to what you mentioned, Luke, we've talked about this a lot as well. when it comes to the human services, social services space generally, it's certainly a calling to do the work. So the people who are doing the work are usually fantastic, but there's never enough people. So to me, a big gap in the system is, a highly paid enough workforce to be doing this critical work and getting people to stay in this industry versus in other industries that might be a little bit less stressful and equally or slightly better paid. So, Keith, why don't we start with you on kind of the quick gaps in the system analysis before we move on?
Yeah, and I'll pick two to leave room for everybody else. I hope to not try to rattle off all of them. I think the two for me are, number one is, housing first has come up repeatedly. I think, we have a shortage of housing first models in general, but also I think what people how people define housing first can be sometimes problematic. So like we've had providers here say they do housing first, and what that means is like they'll allow people who are on buprenorphine or methadone to like be in their housing, right? And that's not housing first, right? For me, housing first is literally like as you are, whether you're using substances or whether your situation's chaotic, right? That housing stability is the first step, not some step along the process. So low threshold drop-in models, we need more of those. So clubhouses, low threshold places where people can go. And I think the one I really want to focus on just real briefly is the real lack of trauma specialty care across the entire spectrum. And so, I started my career in HIV work. I've worked with lots of different populations of folks. I ran a syringe exchange program working with folks in chaotic use, dealing with myriad of issues. And there was one common thing that I think the people whose circumstances were the most challenging had in common, and that was a trauma history and the constant trauma of the environment that they were living in and the things that they had to do to survive. And so for me, good luck finding a trauma specialist, anywhere, much less once you get outside of, sort of urban density areas, so again, I'm sure any person who's New York City based will tell this panel that there's a severe lack of providers there. I will tell you there's a severe lack of providers here. And then once you add on top of that, how many of those trauma specialty providers take Medicaid for services? It's almost none. I don't think you can find one here at all. And so there's this constant cycle, right, where I think we all know people and examples where if they were in a safe place to live and they had an effective series of providers who were all trauma specialty providers, that they would make leaps, not just little advances, but leaps in sort of where they want to be in their life. And those services don't exist.
I'll just say that definitely I agree with Keith 100% on the housing first, especially the fact that a lot of our providers don't actually give housing first as it needs to be, particularly from the mental health side with the ACT teams associated with them. So you have those mental health supports going in multiple times a week to support people. And the second thing, you mentioned, I think both you, Pat, and Jennifer mentioned it, but workforce. Especially within the mental health and substance use field, we struggle to retain workforce. Everyone who works in this field doesn't do it for money, but we still have to feed our own families. And the fact, looking at some of the vacancy rates, we've done studies where we see almost 30% vacancy rate amongst our providers. And even if we were, completely staffed, that doesn't even get to the demand of services that we currently see. So people are on long wait lists for services that are critical to keep them housed, to keep them from going to the street, to keep them out of hospitals. And we just don't have the workers to provide that. And a lot of that is because our industry has been inadequately funded. We have a large percentage of the folks who work in mental health and substance use are themselves eligible for some of the exact services that they provide, eligible for food stamps, are on food stamps, eligible for housing vouchers, these things that, if you're continuing to struggle with the economic impacts of low pay, it's hard for you to focus on your job. And the truth is our work is predicated on relationship building. That's why programs like Clubhouse work so well. It's because it really works to create quality relationships with people. And you can't have consistent relationships if you have workers constantly leaving for better paying jobs that they might not even want to do because they're not passionate about it, but can't continue to do this kind of work because there just isn't enough pay to provide for their families as well. So that I think housing and the workforce are the biggest pieces. And then I'll also say just a dearth of services. So we need far more services and the availability of those services that actually do work.
Great, thank you. Ken and Jennifer, really quickly so we can get to one or two Q&As. Thanks.
Yeah, no, I agree with all of that. And I think, supportive housing, housing first, unfortunately, at times it's been viewed as housing only. That is not what the best forms of housing first are. And so I think in both of those, we need more of it. And we also need the resourcing so that the supports that are supposed to go with it can be done. The only other thing I would add is that, especially as we head into something with such an uncertain federal budget climate, the need to commit to the kind of both innovation and connection between those who are all in direct proximity with individuals in need is only going to become more important as we go forward. And so I think it's going to be something that we're going to continue need to double down on. And, with our government, private sector, philanthropic partners, ensure is really core to the creation of the continuum that we need.
Yeah, and I will just add, I think to the point on workforce, the fact that I've received inquiries in the past from shelters asking for assistance for their own staff on public benefits issues, because it just really signals to me that there is a severe lack of resources for people that are working full-time to still be in need of ways to navigate an intricate and overly complicated system just to be able to have their own foundational needs met, but still show up to work and help other people meet their foundational needs. That's very challenging. The other piece, just to add to what Ken noted, I think having pathways, knowing that there are such limited resources, both financially and in terms of workforce, being able to have pathways to adjust problems as we're seeing them and be able to really know that when issues come up that we think could have a fix to them, to know that there is a desire to improve things. There is a desire to take what we know on the ground working with clients and turn that into policy changes, larger changes. I think knowing that there's even an interest in that would be really helpful, because I think a lot of times, in my own role, I see a lot of the same issues over and over and over again. And if you're talking about limited resources, it's much easier to solve a problem from the top rather than to continue to deal with the same issue over and over again on individual case bases.
Great. Well, thank you all. Mindful of us having 4 minutes on the clock and being proud of the fact that we end these programs right on time. Chell, did you want to throw one or two questions that have been submitted either in advance or during the meeting into the fold here, and we'll see what we can answer before time's up?
Sure. We've talked a little bit about changes at the federal level. Given that there may be even more challenge to kind of fund programs like Section 8, housing vouchers, as well as programs incentives for affordable housing, right? Do we see opportunities for New York State at the legislative or executive level to step in and address some of these gaps?
I'm happy to jump in.
Please,
I will note that for New York City, at least, our Section 8 wait list continues to be approximately a decade long, give or take. There was a little bit of a window during the pandemic to help get additional vouchers issued. But outside of that, the wait list is extraordinarily long, and we just generally can't even rely on programs like Section 8 because they are so few and far between here for new vouchers. I think expansions of programs that we know are making a difference here, like city FEPs and just general FEPs, housing vouchers, make a really big difference in being able to expand the capacity of people to be able to move into permanent housing, while also safeguarding to ensure that those vouchers will be accepted and tenants won't be discriminated against if they're receiving those vouchers. I think you have to approach both pieces of it without the certainty of what may happen at the federal level.
Yeah, I'd also say from a mental health substance use standpoint, I think the federal changes are looking to be quite drastic and very concerning from our sake of things. I think it is up to the state government to, one, help fight these changes that are being proposed, and then two, do anything that we can to really supplement the loss of funding. I think one thing that's particularly concerning for this for this panel is the attacks on housing first that the administration has been pushing out, a call to really increase sweeps of folks who are dealing with homelessness. And, coupled with the recent grants pass decision, the ability or the push for more states and more local governments to do these sweeps and really punish people through criminal charges. So we're really seeing a move away from support and treatment and more towards coercion and institutionalization, which is really concerning because we know, one, institutionalization has never been effective, and two, it is incredibly expensive, which only leaves less money for things that we know work in the communities and things that actually do protect people's rights while getting them the support that's needed.
So, Chell, I think we're right at time here. I always want to offer folks that if you have Q&As that are not, or questions that are not answered here, please follow up with our team. We'd love to engage, further discourse and discussion on these topics if we couldn't capture them today. One other piece we wanted to get to, which we weren't able to get to, has to do with kind of the impact of federal immigration policies on state and local government. Fortunately for you all, we actually have a program just like this coming up on May 22nd where we're going to discuss just that. So we hope to see a lot of you there and to see you at some other programming soon. So, Chell, any final words before we break?
No, thank you. We will follow up by email with information about that upcoming program.
Great. Thank you all again for attending today. Thank you to all of our fantastic panelists and for shining a light on a really important issue that I don't think ever gets enough attention. So thank you very much. Thanks for the work you're doing, and we'll see you all really soon.